A new study has found that the alarming rise in the number of missing girls up to 6 years old in India is caused by selective abortion of girls and suggests that up to 12 million girls have been aborted over the last 3 decades. The study, led by the Center for Global Health Research and published in the prestigious medical journal The Lancet, found that overall there are far fewer girls compared to boys in India than would be expected. In most high-income countries where there is no cultural preference for either boys or girls, slightly more boys are born compared to girls. This natural sex ratio ranges from 950 to 975 girls per 1,000 boys at birth. But in India, even fewer girls are born. The study examined 250,000 births from the National Family Health Surveys in India over 15 years, focusing on the sex ratios for the second child in the family. Researchers found that in households with a daughter as the first child, the sex ratio for the second child dropped to 906 girls for every 1,000 boys in 1990 to a mere 836 girls per 1,000 boys in 2005. By contrast, sex ratios in households where the first child was a son were not unusual. The researchers conclude that the considerable number of missing girls reported in the 2011 census is the result of increasing number of households using prenatal sex determination followed by selective abortion. The study also reported that there was little change over the time period from 1990 to 2005 in preferences for a son.
There are evidence that the fertility is declining considerably in India, and therefore, with continued pressure on families to have a son, the families become vulnerable to look for the means to ensure that when they have smaller families, they at least have one son.
The study found that the selective abortion of girls is more common in wealthier households and among women with at least 10 years of education. One possible explanation for this pattern is that compared to poorer households, richer families can more readily afford the ultrasound required for prenatal sex determination and abortion services.
What we found is the households that were at the top of the income ladder had a much greater decline than the households that are at the bottom of the income ladder. So this is really a phenomenon of the educated and of the wealthy that we're observing in India.
Using the data from 1991, 2001 and 2011 Indian censuses, researchers estimated that 4 to 12 million girls have been aborted before birth over the last 3 decades. More girls tend to die between 1 month and 5 years of age compared to boys. But this higher girl mortality was taken into account in the study methods. In the past, only specific districts were considered hotspots for selective abortions. But the study concludes that today most of India's population live in states where selective abortion of girls is believed to be common. In 1991, only 10% of the Indian population lived in states with a very low sex ratio of girls to boys. This percentage rose to 27% in 2001 and in 2011 was a staggering 56%. What was once a problem primarily in the northern and western states has spread east and southward, now affecting almost all areas of India. The consequences of such a gender imbalance in the country could be enormous. This indicates that the Prenatal Diagnostic Techniques Act, or the PNDT Act, which was implemented in India in 1996 to discourage prenatal sex determination and abortion, has not been effective overall. This also reflects that the government can currently do little to regulate the large number of private doctors and clinics where most Indians go for services. However, despite the fact that the PNDT Act may not have been as successful as it was intended, it still might have had some impact. There has been some improvement in the sex ratios of some areas that were previously considered hotspots for selective abortion, including the states of Haryana and Punjab. While the researchers did not find any impact on the sex of the firstborn child, they caution that this might change if families decide to have only one child. In China, the government enforced a one-child rule, and this led to families feeling the pressure to control the gender of their firstborn. The study found that Indian families with existing daughters are most at risk of aborting more girls. Researchers suggest that ongoing reporting of selective abortions of girls in each district of India might help reduce the practice. The study provides national evidence for the choices that families and society need to make for a more balanced and secured future for India.